If a consultant in a specialty is still doing nights and weekends and on calls, you have to consider, would you be happy doing that forever? And would that give you the balance in your life that you want? Because if the answer is no, then that is not the specialty for you. Hey guys, welcome back to the channel. My name is Kiran. I'm a junior doctor and a comedian working in Manchester. I recently got 1,000 subscribers on YouTube, and so I'm doing a Q&A from questions from my Instagram. This is part 2 of the Q&A because I got so many questions, I had to split it into 2 videos. If you've not seen part 1, feel free to check that one out. I talked about all the personal questions, I talked about medical school, and I also talked about my journey on YouTube. In this part 2, we're going to be talking about life as a doctor, we're going to be talking about money as a doctor, and also other questions about healthcare in the UK. As always, make sure you're subscribed to the channel, but let's get into it. Being a doctor. Is doing an F3 year as a locum looked down upon in the medical community? I would say no. There's lots of people doing it. Everyone knows that it's become more and more a part of being a trainee doctor, and a lot of people are taking time out. So I don't think it is looked down upon when you're a doctor. Also, when you're there, you're still helping out. You're still working, and without these F3 doctors in the hospitals, there would be gaps in the rotas, there'd be less people working, and ultimately, the work for everyone else would be harder. So I think people appreciate it's a temporary thing that people do, and I don't think it's looked down upon. Did you always want to be a doctor? This is something I kind of answered in the last video, but the answer was no. I never really knew what I wanted to do. For a while, I kind of wanted to be Prime Minister, so I was thinking about doing politics and economics and that sort of thing, but I was always quite strong at sciences, and so decided to go down the scientific route after a little nudge from my Asian parents. So 3 quite similar questions here. 1, would you travel abroad to practice medicine? 2, where according to you is the best country to work as a doctor, and would you ever move there? And 3, would you ever move abroad? Maybe Canada, very specifically, maybe Canada. So would I go abroad to practice medicine? The answer is 100% yes. I would absolutely love to, but I don't think I will. The things that keep me in this country are that the healthcare system is free, so anyone can access it, and I love that. And 2 is that my roots are here now. My family are here, my grandmas are here, my friends are here, my university friends and school friends, and I don't think I could leave that. If I did go, I would go temporarily to work and come back. I think it would be really cool to work as a doctor in America, maybe in New York. The 3 places I'd consider working as a doctor are North America, so America or Canada really, because I think doctors are paid well there, and it's just a very different life. Number 2 is Australia. The lifestyle out there is really cool. So I've got friends working in Australia that can go to the beach after their shifts. And number 3 is the Middle East. Middle East because it's a bit of an up-and-coming place, and you can earn a lot of tax-free money as a doctor in Dubai. What are your aspirations as a doctor? I think the main thing for me is to be there for people that need it. So I'm training to be a GP, so I want to be able to help people in the community. I would also love to be a media doctor as well. So if I could get any experience on radio or on TV, I'd love for that to be part of my career path as well. How do you separate yourself from patients not to become emotionally attached? I think it's quite difficult sometimes, especially in situations where something bad has happened. So if you're giving a very bad diagnosis, or if someone's passed away, it's difficult to not feel the emotion attached to those things. You need to be empathetic, but at the same time, you can't carry that burden with you all the time. If you keep carrying that with you all the time, it's going to drain you and drain you and drain you, and then at some point you're going to burn out. Can you explain the whole hierarchy of doctor, GP, consultant, registrar? I can. So it starts when you pass medical school, so you do 5 years at medical school, then you do 2 years of foundation training as a new doctor. After that, you study to become a medical doctor, a surgical doctor, a GP, or something else. So if you want to do medicine, you do core medical training, and that is now 3 years long. So it's called IMT and it's 3 years long. After those 3 years, where you're a senior house officer or SHO, that's what they call it, you become a registrar. So registrar is the one below consultant. So you become a registrar, you work as a registrar for 4 or 5 years, and then you become a consultant. For GP training, after you've done your 2 years of foundation years, you do 3 years as a GP registrar and you become a GP after that. As an Indian, have you faced any passive racism in your work field and during uni? I think there is passive racism everywhere, and hospital is not an exception to this. Some examples I can give are when you work on elderly wards and people do make inappropriate racial comments, especially elderly white people. But I think in those situations, you've got to understand the context. With regards to promotions and moving up the ladder as a doctor, because the system is all formalized now and it's all done on scores and interviews and tests, there isn't really that institutional racism that you may see happen. The next question is, what has been your training pathway in the UK? Please can you break it down? So I kind of explained this already. I did 5 years at medical school. I did 2 years of foundation training. I did 1 year as a locum FY3 doctor, and I am now working as a GP trainee. So GP training is 3 years and I'm in my first year. How is the hospital life and dynamic between colleagues? That's one of the best things about working in the hospital, is that you do have a multidisciplinary team. You're working with lots of different people and it's so easy to make friends and it's a really social place. So I'd say that the dynamic is great. You make lots of friends with not only the junior doctors, but also the nurses, the ward clerks, the physiotherapists, the pharmacists, everyone else that's in the hospital too. You're all one big team. Which specialities give you a good life balance? Love your content. Thanks for that. This is my opinion, but anything that you can turn into elective or clinics is going to give you a good life balance. So the one that obviously comes to mind is GP, which is what I'm training to. One of the main reasons that people do GP training is because they get that balance in their lives. If a consultant in a specialty is still doing nights and weekends and on calls, you have to consider, would you be happy doing that forever? And would that give you the balance in your life that you want? Because if the answer is no, then that is not the specialty for you. There's lots of other things that have good work-life balance, just to name a few, like dermatology, ophthalmology, rheumatology, things like that. Can someone with a mental health diagnosis become a doctor? Yes. So there are doctors I know with mental health diagnoses that are on treatment that can still work. Top apps for junior doctors. Number one is an app called Pocket Doctor. It's got some prescribing rationalization, it's got some plans for unwell patients, and it's just quite a good one for new doctors that are on call. Number two is the BNF, which has all of the medications that you need to know, as well as the doses and the indications. And in my hospital, we have an app called Induction. Induction has the telephone number of anyone in your hospital. So some hospitals have this Induction app. The reason that's good is because as a junior doctor, you spend 99% of your life on the phone, so it's good that you've got that number handy. These are questions about international medical graduates. I'm not an international medical graduate. I was born in the UK and I studied in the UK, but I'll try and answer these questions if I can. Please tell me about surgical training in the UK. I've already kind of explained that. 2 years of foundation years, 2 years of core surgical training, and then you train as a registrar for another 5 years. How is paediatric training in the UK? Very similar to what I've already described. It's very similar to medical training. How is life in the UK? Feeling satisfied or any future plans? Life in the UK is good. Obviously I was born here and I grew up here, so I don't know anything else, but definitely recommend it as a place to be. Now a section about money. How long did it take to save for a house deposit as a doctor? It takes quite a long time to save for a house deposit. I was quite fortunate in that my parents agreed to help with my house deposit, but in the UK there's also a help to buy scheme. So you can put a 5% deposit down if you're a first time buyer, which on a property is still a lot, but is not as much as putting a 15-20% deposit down, and the government will front the rest of the deposit. Do you think doctors earn enough? That's quite a difficult question to ask, and I don't think I'm in the best position to answer it. I think that considering the responsibility that doctors have, they could probably earn more. And considering what's on the line when they're working, and every decision has a big consequence, there's sort of litigation hiding behind every decision you make as well. So that level of stress and that level of responsibility represents the amount of pay that you get. Now, some general questions about healthcare. Where are medical students in the queue to be vaccinated? That's a really good question, and the honest answer is that I don't know. I would say if you fit into any of the at-risk groups, or if you're over a certain age, obviously you'll be in that category, but I don't remember reading anything specifically about medical students getting the vaccine. So apologies that I can't answer that one better. If you could swap lives with another healthcare professional, what would it be and why? I think definitely nurses. I think the nurses are so underrated and underpaid, and they work so hard. So I would like to see what a nurse does in a day shift and in a night shift so that I can more appreciate what they're doing in the hospital. Can you tell us more about the NHS system more elaborately? Not really, because I don't know it. What I do know is that in the NHS, at point of care, healthcare is free. So for anyone in the UK, healthcare is free. And that's one of the best things and the main things about having a national health service that's paid for by people's taxes. What are your thoughts on physician associates? Have you worked with any? For those of you that don't know, physician associates are a new role that were introduced several years ago to help doctors in the hospital, thus the name physician associate. There was a bit of an uproar when they started bringing them in, because there was this whole thing where they said they're being paid £50,000 and haven't gone through medical school. I think that's a load of nonsense. I have worked with physician associates, and anyone that can provide an extra helping hand in the hospital is welcome on my watch. From what I've seen, physician associates can review patients, they can do discharge summaries, they aren't able to prescribe, so that's one of the main differences, but they're able to do a lot of things to reduce the workload of other medical staff. Therefore, I think they are very welcome in the hospital. What would you like to say to people who are afraid of the COVID vaccine? I think I can't say anything that hasn't been already said. We've been through such a turbulent time in 2020. We're locked up in our houses, we're away from family, from friends, and we have to consider, how do we get out of this? How are we going to stop this happening? Ultimately, that is by eradicating this virus or minimizing the spread of this virus. And the way we're going to do that is by vaccination programs. The more people that are vaccinated, the less spread there is, the less people get it, and the less people are killed by it. I think that is the underlying thing. The less people that get the virus, the less people that are going to die from it. Therefore, we should be getting vaccinated. That is the end of the Q&A, guys. I have just finished recording this Q&A for about 2 hours, so I am done with these questions. A big thank you to anyone who has sent in questions. I hope you enjoyed it. Please drop me a comment below if you've got any more questions about any of these answers, and I'll do my best to answer them. As always, if you're new here, make sure you subscribe to the channel. Take care, guys, and stay safe.